All right, hi, good afternoon, everybody. If at any time during the talk we have some problems with the mic or you can't hear me, just let me know, we'll fix that. But I'm very excited to talk to all of you guys today about some natural approaches that we can use for cold and flu season. And I am a family medicine and integrative medicine physician. I practice over at the UCLA Century City office. And my goal today is really just to provide you guys with maybe one or two things that you can use this season and seasons to come to keep you all very healthy. So for those of you who don't know what integrative medicine is, as an integrative medicine physician, I commonly use nutrition, mind-body medicine, exercise, some judicious use of herbals and supplements in order to kind of complement and enhance traditional medical therapy. So as an integrative provider, I'm oftentimes looking at your sleep habits, the environment that you live in, your relationship with the community, what it is your dietary practices are, and kind of some of those daily rhythm things that happen and how they either go on to either promote health or to promote illness. Like I said, we do use some supplements in integrative medicine, and I don't really like to think of integrative medicine as kind of the sick to the supplement, but it's really kind of this all-encompassing approach to where we do things to support your body's natural ability to be well. So if you find something in today's talk as far as a supplement that you're interested in, please do talk to your physician first, because supplements are medications. They have their own side effect profiles. They have their own medication interactions, and they're not meant for everybody. So do discuss them with your doctor on kind of an individual basis if you find something interest. So three big parts of today's talk. So I'm going to give us a little bit of cold and flu background just to orient us. The big portion of the talk today is on prevention strategies that we can use. And so, of course, we all want to stay well, and that's really the focus of today's talk. At the very end, we'll go over a couple of things that you can try to do as kind of get well fast strategies, because I did want to leave you with just a few of those things. So cold and flu overview. Is it cold or is it flu? Oftentimes it can be hard to tell, right? Because a lot of the symptoms between colds and flus have a lot of overlap. In general, flu tends to be more abrupt onset with high fevers. People get a lot sicker. You can have muscle aches and pains and headaches. Whereas if you have something like the common cold, people will commonly complain of symptoms of like runny nose, nasal congestion, sore throat, and the onset tends to be more gradual than something like the flu that's very abrupt. So flu can have really devastating health outcomes. So with flu, you can end up with a secondary bacterial infection, you can end up with pneumonia, hospitalization, all of these things that we don't really see as a result of colds. This last year, 2017, 2018 flu season was very long for us. And we saw a lot of really devastating health outcomes. So we had over 30,000 people that were hospitalized this year as a result of flu-related illness. We had 185 children that died as a result of flu. So you really want to do everything that you can to protect your family and the community. And at UCLA, we do definitely recommend getting your annual flu vaccine, so that you can do that and prevent these devastating things from happening. At UCLA, it doesn't require a physician appointment to get your flu shot. It's really just a nurse visit, very simple. You come in, we give you the flu shot, and like I said, very, very easy and accessible. With respect to the common cold, there's over 200 different types of viruses that cause cold. The most common type of virus that we see causing cold is rhinovirus. And so that makes out about 30 to 50% of the common cold cases. So a lot of the therapies that we'll talk about later that we're testing their effectiveness against common cold actually used rhinovirus, and that's because it's the most common reason that people come down with cold. So colds are viral, they're self-limiting, so they'll resolve somewhere about 7 to 10 days after their onset. However, unfortunately, some surveys show that about 50% of people that go into their doctor receive unnecessary, inappropriate use of antibiotics. And I think we've all heard the party line about inappropriate overuse of antibiotics is creating these super bugs or super infections that really cause us to have a limitation on what antibiotics we can use in the future if we so need them. Also in primary care, as a result of antibiotic use, we see a lot of people that come in with things like vaginal yeast infections, antibiotic-associated diarrhea. Sometimes you can end up with something called C. diff, which is a very bad gastrointestinal infection that causes watery diarrhea, sometimes hospitalization and death for certain people. So antibiotic use, definitely necessary when necessary, but we want to be prudent with the use and only use them when we need them, because you do kind of disrupt some of that normal flora that's found on the body, that bacteria that you have a nice symbiotic relationship with. So this is a diagram that I took off the CDC website, but it shows us the peak months of flu activity over about the last 35 years or so. And actually cold activity much mirrors the same as flu activity. It's always difficult to predict when flu will peak because it varies from year to year, but usually it's sometime between October and March. And there's several reasons why it's thought to kind of peak during the cold winter months. So, when the weather is colder, obviously we're more likely to be indoors in crowded areas with people. And if someone has a viral infection, it's easily spread to the rest of the group. Also, viruses tend to live better in kind of these drier environments. So although the weather might be raining and wet outside, actually the air quality, the humidity is very low. And so in addition to having this dry air, you can think of it as being irritating and drying to our nasal mucosa and our mucous membranes that help protect us from infection. So when they become dry, they're more susceptible to getting infected with these respiratory viruses that are hanging out. So this is a diagram about a typical flu course. And so you can see along the bottom of the slide here is the day length, and so this is the time when you become infected with the flu virus. And the white boxes here show us total symptom score. So the higher they are up on the graph, the worse that you're feeling. The black dots here represent viral shedding, and so what that means is the amount of virus that you're actually shedding to your environment, how infectious you are to other people. And so we can see that, the typical length is about 9 days for the flu. You feel your worst around day 3 or so, and then gradually with time you start to feel better. With viral shedding, so infectiousness, it actually peaks a little bit before you feel your worst. So, and then it trends down thereafter. So cold and flu prevention, like I said, this is going to be a big piece of today's talk because nobody likes feeling sick. We all want to feel well. In addition to wanting to feel well, this is it's a big economic burden on the United States. It's, billions of dollars are spent every year because of colds and flus. And so this accounts, visits to your medical provider, hospitalization, prescription, non-prescription medications, not to mention the productivity and work lost as a result of cold and flus. So in order to attempt to try to make it a little bit more interactive for you guys, or engaging, if you will, I put together a slide at the beginning of this section and then at the beginning of the Get Well Fast section. And so we don't have to share our answers, but you can just kind of think of it. So one of these statements is a lie, 2 of them are true, so basically picking out the false statement. And so I'll read them through to you, and we'll go over the slides, and then at the very end of the talk, you'll be able to easily identify which one is the false statement. So A, positivity and emotional style may predict the odds of coming down with the cold or flu. B, although obesity is a known risk factor for heart disease and diabetes, it may actually be protective against colds and flus due to higher levels of nutrient stores. And C, shorter sleep duration has been shown to correlate with increased risk of coming down with a cold. So I'll let everybody just read that again to themselves real quick, and then you can think about it, and then at the end, I think you'll know the answer. Okay, so everyday preventative actions. So this is kind of the low-lying fruit, the stuff that really we all should be doing in order to keep ourselves and everyone else healthy, but definitely worth mentioning. So if you're sick, you should stay at home. We tell people when they come to the clinic that they should be at home for at least about 24 hours after they have resolution of their fever. And that's because they're less infectious to other people, like we kind of saw on that slide about viral shedding. Cover your coughs and sneezes with a tissue. So these cold and flu viruses are largely spread by respiratory secretions, and it's projected that flu actually can travel up to 6 feet. So definitely covering those things with a tissue. Washing your hands often for 20 seconds at a time. And so this is actually 2 run-throughs of happy birthday, which is kind of a long time. If you don't have soap and water, the next best thing to that is an alcohol-based hand sanitizer, and we say at least having 60% alcohol content. Making sure that you're frequently cleaning shared surfaces and objects. So using something that either has a hydrogen peroxide or a bleach base, something that says that it kills the majority of viruses, and wiping off things like door handles and refrigerator handles and countertops, because it's actually these hard surfaces like elevator knobs and handrails that carry these viruses for longer on them, which is kind of surprising because you may think that it's actually like linens and pillows, but it's really these hard things that carry the viruses longer. As a family medicine physician, we see a lot of people, especially this time of year, that come into the office and they end up walking out with a diagnosis of cold and then in some cases flu. The question that I'm often asked, in addition to how can I feel better, is how do I not spread this to my family? A lot of people have young kids at home, or they have a spouse that's under heavy deadlines at work, and they just don't want to get the rest of the family sick. So should I wear one of these face masks? Should my family wear a face mask? And actually there was a study that came out that was funded by the CDC in 2009, looking at whether the surgical type face masks were effective in preventing spread of flu virus to a household if someone in the household was diagnosed with having flu. And so in this study, they looked at close to 300 different households. It was a randomized controlled trial. They had 3 groups. They had a group that did nothing, so no intervention. They had a group that did hand washing alone, and then they had a group that did hand washing plus the use of these lightweight surgical face masks. And they found that actually hand washing in combination with the use of surgical face masks was effective in reducing spread of flu among the home if it was implemented early in the infection. So within 36 hours of the family member being diagnosed with flu. A couple of years after this, so in 2012, there was a review article that was put out, so looking at all of the studies that had looked at surgical face masks as well as these N95 respirator masks to see if they were helpful. So for those of you who don't know, N95 respirator masks, they're like these real thick masks. I don't know if any of you have experience with them, but they do sell them in grocery stores and stuff like that. But they're a little bit more cumbersome to wear, if you will. They're pretty thick. Some people can feel kind of claustrophobic, but so they looked at the N95 respirators and the surgical face masks, and they came up with much of the same conclusions as this study. They said that these face masks tended to be protective, but really when used in combination with other preventative actions, and they really underlined the effect of the importance of hand washing. They also went on to say that, it should be done early, so the earlier you start implementing this practice, the better. And also wearing the face mask correctly, so tight over the bridge of the nose, under the chin, so there aren't big holes in the mask, and consistently. So we talked a little bit there about protecting us from breathing in those viruses that cause infection. Before I mentioned that when the air is dry, when there's no humidity outside, that the nasal mucosa becomes very dry, the mucous membranes become dry, and we become susceptible to infection. So what if we simply wet the mucous membranes with something like normal saline? Is this helpful? There's lots of reasons why we can project that saline would be helpful, spraying saline into the nose would be helpful to protect us from infection. And so the first thing is that when the nose is wet, you actually have improved functioning of cilia. And so cilia are these hair-like projections that come up off of the epithelial surface, and they make this sweeping motion, and they sweep to clear the nasal passages. And when the cilia are wet, they function more optimally. Also, when you're spraying saline into the nose, you're actually getting just removal of stuff that's there that's causing inflammation. And because you're removing things that are causing inflammation, you have decreased markers of inflammation. So there was actually a study done in Sweden, albeit small, over the course of 20 weeks, where 10 weeks they had participants putting saline into the nose, and then 10 weeks they had them doing nothing. And they found that when they were putting saline into the nose, that they had a small increase in protection against becoming ill. So on average it was 0.7 episodes versus 1 if you weren't using the saline. But they had a pretty major protective response as far as symptoms. So people that were using saline nose sprays, they had less symptoms of kind of blocked nose or runny nose compared to people that weren't. And so we're talking 6 days of symptoms versus 11 days if you weren't using saline nose spray. So saline nose spray. It's pretty cheap. It's safe. It's easy to use, and so it might be part of a nice preventative practice, as well as if you do end up getting sick, to make you feel better. So when we're talking about the ways that the body protects itself, there's 3 main things that we can think about. So first is a physical barrier. A step beyond that, we have innate immunity. And then lastly, we have something called adaptive immunity. So really our immune system, so our body's ability to protect itself, starts at this kind of physical barrier. So it's the interface between the outside environment and the inside of our body. So much like we think of the skin as being a protective layer, really also the lining of the respiratory tract is as well. And what I was trying to do from this picture is just to illustrate to you that, we're really in contact with the outside environment, right? So this whole lining is kind of the first layer that we have to get through. So if you break a physical barrier, then we have something called innate immunity, which is kind of this non-specific immune response that is fast acting. It creates inflammation, and you get recruitment of immune cells to the area to help fight infection. And then beyond innate immunity, we have something called adaptive immunity. And so adaptive immunity is kind of this a little bit slower to act, but more specific response to infection. And so this is how things like flu vaccine work, right? So you're injected with an inactive flu virus, and over the course of a couple weeks, you create antibodies that are specific to the flu. So if your body encounters a real flu virus, it can quickly attack it. And so there have been a few vitamins and then an herb and mineral that have shown promise in all 3 of these layers of protection. So, and these things have been vitamin D, vitamin C, zinc, and echinacea. And so there was a review that was put out earlier this year looking at all of these different evidence on D, C, zinc, and echinacea, trying to make kind of broader statements for people with respect to if they should use it, who should use it, and dosing. And so over the course of the next couple of slides, I'm going to take you through these guys. based upon the review from earlier this year. And so this review, it included 26 studies on vitamin D for prevention and treatment, and the authors concluded that vitamin D overall appeared safe and possibly effective in reducing respiratory infection. And so there were a lot of studies, though, that showed no benefit in people using vitamin D to prevent respiratory infection. So they tried to come out with the common denominator for what patients it did work in. And what they found was vitamin D supplement was helpful for people that were deficient in the first place with vitamin D. If you supplemented them back up to a normal level, they seemed to have protection. And then those patients that weren't receiving bolus supplementation. And what I mean by that is that there was a study, for example, using 100,000 international units of vitamin D once a month, and they did not show protection in respiratory infection, as opposed to taking it as kind of a lower daily dose seemed to be effective. Authors thought that 1,000 international units was good for most people. Of course, everybody's going to be a little bit different, right? And they recommended starting supplementation in early autumn to ensure that there was adequate levels of vitamin D available come winter. And so most people will have a small dip that happens over the winter months in their vitamin D stores. And that's because some of the ways that we make vitamin D is through the skin. And so what I was trying to show from this kind of complicated schematic here, but is that there's two main ways that we get vitamin D. So one is through dietary sources, and we absorb that directly into the bloodstream. And then other than that, we synthesize it from UV radiation. So sunlight hits the skin and makes vitamin D. And so that's why during winter time, we're not getting as much sunlight, and therefore we're not making as much vitamin D. So kind of preparing for that, if you will, by taking a little extra vitamin D.
Is there a difference? Vitamin D3 I take?
Yes, vitamin D3 is actually the preferred form to be taking as opposed to D2. Yeah. Yes. So moving on to zinc, which we're still talking about the review, and that protected us on all those three levels. But zinc, they found it was 28 studies on zinc, and they found that it wasn't a preventative thing that you could take, but it seemed to be helpful for people in shortening the duration of a cold by about 1/3. They found that it seemed to be most beneficial in studies that were either looking at the very old or the very young, and that the authors recommended that the best way to be taking zinc would be in a lozenge form every couple of hours while you're awake. I think it's worthwhile to note that mannitol, citric acid, sorbitol, these are things that can be found in lozenges as flavor enhancers, and they actually decrease the availability of zinc. So these things, mannitol, citric acid, sorbitol, will bind to zinc so that you're not able to adequately absorb it and get the proper use from it. So also avoiding intranasal zinc preparation, so avoid those things where you spray zinc into the nose. There have been some case reports of people actually losing their sense of smell from using intranasal zinc. Echinacea. So echinacea has been used for hundreds of years, antiviral, antibacterial, wound healing properties. It's very popular in Europe. They looked at 14 studies on echinacea, and it's commonly used as more of like a liquid, a tincture type form, but at doses of 2,400 milligrams per day, useful for prevention, and about 4,000 milligrams per day if you're kind of in the stage of having a cold. I would note, though, that echinacea falls within this kind of daisy plant family, so if you have a known allergy to daisy plants, this would not be something to take. But again, with the use of any of the supplements or herbals or anything, do talk to your provider personally about them. And so lastly, vitamin C. So vitamin C, there were 14 studies that they looked at for vitamin C. It didn't seem to be helpful in the average adult for preventing infection. If you took 1 to 2 grams per day, it may be helpful in reducing the length of your cold and how severe the cold is, but it didn't protect you from getting a cold necessarily in the first place. There was one study that looked at a combination of vitamin C and zinc. Let me go back. Vitamin C and zinc, and it seemed to be helpful in reducing symptoms. So vitamin C and zinc might act together with some sort of synergy to be more protective. I wanted to mention, so we're moving outside of that review that I talked to you about, but there was a Cochrane review that came out specifically on vitamin C, and they were looking at 200 milligrams per day of vitamin C for prevention and treatment of colds. And so they had the same findings that we talked about before, that regular use among the average adult doesn't seem to protect us from getting sick. But they did note that there was regular use of vitamin C. It does decrease the incidence, so whether or not you get a cold among athletic people. So when they looked at groups of marathoners or skiers or soldiers, they were about half as likely to develop a cold if they were taking a daily dose of vitamin C. And so there's no reason for us to think that this doesn't translate, of course, to other athletics outside of people that are marathoning, skiing, and being soldiers. So, and regular use does seem to decrease the duration of symptoms among adults by 8%, and children have a little bit greater protection at 14. So I did want to point out that aside from supplementation, of course there's lots of great dietary sources of vitamin C. I usually recommend to people as much as you can to get things through the whole foods that you're eating. There's something that is lost when we try to take these protective components and put them into pill or capsule form. Because they're packed with a lot of phytonutrients, and plants are smart and they know how to synthesize things together so that all these things are nicely available to us. So you can eat 1.5 red peppers, 1.5 kiwi fruit, you can eat some broccoli, spinach, all of these things will get you at least 200 milligrams of that additional vitamin C during cold and flu season. I liked how on this diagram there was sauerkraut at 1 kilogram. That's 2.2 pounds of sauerkraut you could eat to get 200 milligrams of vitamin C. So if you're a real sauerkraut enthusiast, that's an option. Okay. So nutrition and immune function is a really important point. So when we think of kind of optimal immune function, it's a spot where nutrition is just kind of at its perfect balance point. And so there's 2 ways that we can either tip the scale to make immune function non-optimal. So we can have these malnutritive states, so things like anorexia and other malnutrition disorders, where you don't, for example, have enough protein available for you to make antibodies, and so that can be harmful to the immune system. On the other end of the scale, we have overnutrition. So it's actually, when we have this spectrum of overweight and obesity, it is an inflammatory state that can actually make us more susceptible to infection. And there's a whole field of something called immunometabolism. So it's a whole field of medicine and biology where they look at different metabolic disorders and nutritive patterns and study immune response in conjunction with those. So I wanted to focus just a couple of slides here on overnutrition, just because in the United States we have a lot of people that are really struggling with ways to manage weight, and so we define something like overweight and obesity. There's a medical definition that we give it, but it's a weight that's greater than what's considered healthy for a given height. And so in the clinic we have something called the body mass index, which is the BMI, which is a little bit of an imperfect tool, but something where we're able to calculate based on a person's height and weight whether or not they fall into something like an underweight category category: normal weight, overweight, or obese. And so like I was saying, in the United States, we have a lot of people that are struggling with overweight and obesity. And in medicine, we've seen these CDC maps time and time again, and maybe if you're in public health, but I think it's just interesting for a general audience to see these if you haven't before. Have any of you guys seen these maps before from the CDC? No? Okay. So what I'm going to do is over the next couple slides, so we're looking at 2011, and you'll see how the colors on the map change. And so the colors are representing what percentage of the population falls into an obese category. And so we can see that the light green is 20 to 25%, yellow is 25 to 30, orange is 30 to 35, and then this kind of red color is 35%. And so over time we can kind of see, and this is just over the course of about 7 years, that the map progressively gets darker. And then this is from 2017. So like I said, we have a lot of people that are struggling with this overnutrition. And so we do know, so in 2009 we had a really severe outbreak of flu, and in 2011 we started trying to look at significant risk factors for that. And so we found that obesity was actually a significant risk factor for flu infection, and it does have this impairment of immune response to infection, like we were talking about it being this inflammatory state, and it may be able to decrease effectiveness of immunization in some persons. And so I actually pulled this slide from, I went to a really great talk a couple of months ago from UCLA Center of Human Nutrition from Dr. David Heber, who is an endocrinologist here, but he was, this is his diagram, and he was explaining about how abdominal weight is actually inflammatory weight. And so these little, these kind of circles here, they're actually fat cells within the abdomen. And so when you have excess fat cells in the abdomen, you get new blood vessels that grow there. And so these blood vessels are more fragile. They're not as healthy as other types of blood vessels. And so you're prone to getting ischemia, and the cells there kind of die. And then you have macrophages, which are part of your immune system, that come in to clean up this dead cell debris, and then you get release of these inflammatory chemicals as a response. So it becomes really a state of excessive inflammation for people with that excess abdominal weight. And so a few months ago in JAMA, which is a big medical journal, they looked at about 1,800 people over the last 3 flu seasons, and they found that obese persons actually shed influenza A an additional 1.5 days. This was even if they were having mild symptoms or if they weren't having any symptoms at all. And so the authors went on to talk about how, obesity is being a chronic state of inflammation that can actually alter the way that flu is transmitted to other people. And then this is a statement that I pulled from their paper. They were talking about that as the prevalence of obesity rises, like we were talking about from those maps that I showed you from the CDC, that this might be an important target for intervention and prevention of flu. So, of course, we're always trying to do our best at how we can intervene on flu because it has such devastating health outcomes for people. So lots of ways that we can be helpful at UCLA, because like I said, so many people are struggling from overweight and obesity. So really personalized dietary counseling with your physician. Tell us what's worked, what hasn't worked. Not one diet is right for every person, and so really there needs to be some specificity for that. We can also write an exercise prescription for something that makes sense, so type of activity, timing of activity, etc. We see a lot of people that come in that have been off of an exercise plan for a period of time because they have an injury or some sort of thing that's been limiting them from being able to be active. And so we have really great physical therapists at UCLA that we can work with to help you overcome those injuries if you have them, and also kind of modify the exercise prescription that we go over in clinic. Like I said, we have a great Center for Clinical Nutrition. It's made up of a bunch of, we have endocrinologists there, people with extra training in nutrition, and they have lots of resources within the group themselves. We have lots of group classes out in UCLA, and at our own particular clinic in Century City, we have something called Walk with a Doc, if you guys are interested. But once a month, we have one of our doctors where you get out and you walk the mall, because we're actually inside of a mall location. But and it's a nice way to get out, get exercise, ask a couple of your family medicine related questions to the doctor, and create kind of a sense of group and community. So I wanted to transition over to the use of probiotics. Since we're talking about nutrition, we're talking about the gut. So there's this very complex relationship that happens between our gut microbiome, so the bacteria that live there, and our immune system. And because we know that this complex relationship exists, there have been a lot of studies that have started to look at probiotics and whether or not they're helpful in preventing upper respiratory infection. And so probiotics, right, they're some microbiome, they're microorganisms that we take in either capsule or some sort of form to help kind of colonize and
Yogurts?
yes, yogurt will count, something that says that it has live and active cultures, so you want to look for that on the side. But so this review that came out in 2015, so they looked at, I believe it was 13 studies, and then they included 12. So this is basically looking at 12 studies on probiotics to prevent infection. And they did find that people that were using probiotics, that they had less episodes of infection, so they had less number of colds. The duration of the episode seemed to be shorter, or it was shorter rather. Antibiotic use was of course down, and then school-related absence or cold-related absence was also decreased. So seemed to be effective. But like I said, probiotics, they're a little bit of a new science, a new study, and so there wasn't a lot as far as recommendations for particular strains, because this was a review that included many different types of strains. So that was a 2015 review looking at multiple studies, but this year there was another randomized control trial that came out, and so they were looking at 2 different strains of lactobacillus in combination over a few months to see if that was helpful in protecting against respiratory infection. And they did see that the patients that were taking the probiotic with these 2 forms of lactobacillus actually had an improved immune system compared to those persons who weren't. This is a slide or figure that I took from the paper, just because I thought that it gave us a really nice clear visual of what was happening. But we can see that, so the lighter bars are people that were using probiotic, darker bars are the control group that wasn't, but we can see that the incidence of flu with fever and without fever was decreased, and then those people receiving medicine, so of course they had less medication use if they were using the probiotic, and then also some less missed time at work. So we're talking about probiotics. It's important to mention prebiotics. So prebiotics are actually the food for the probiotics. So it's the food that these bacteria can digest so that they can be healthy. And so it's important that if you're using probiotics or probiotics within the diet, to make sure that you also have a diet that's rich in prebiotics. And so to highlight some of these things, we can see the higher numbers indicate more prebiotics, but garlic is a really great source of prebiotics. Dandelion greens, onions, asparagus, artichoke, leeks. So these are all really good prebiotic-rich foods that you can incorporate. And then talking more about food, when we look at, so this was a review on herbal therapies for colds and flus. And we can see that the active ingredients here in many of these is something called polyphenols. So if we're going to try to take a common denominator here, and so what are polyphenols? So they make up a large array of different foods within our diet, but they all share kind of a similar chemical structure, and they act as antioxidants, and they make up the really rich color of different fruits and vegetables. And so polyphenols are what are responsible for all these beautiful colors that we see here. And so when we're eating literally from the rainbow, we're ensuring that we're having polyphenols from all these different types of groups. And there's been a lot of foods that have been studied for colds and flus, and this list is by no means all-inclusive, but I did want to spend just a couple of slides here on garlic, just because I think garlic is such a great food. We just talked about how it's rich in prebiotics, and it's been used for hundreds of years for its antiviral, antibacterial properties. And so there was another Cochrane review that came out in 2014. And so for those of you who don't know what a Cochrane review is, but they're really these gold standard reviews that look at a bunch of different studies, and then they try to make a statement on whether or not we should endorse that type of medical therapy or not. So they had 8 trials that they looked at with garlic. Unfortunately, only one of them met their inclusion criteria, so this is really a review based upon one study. But so this study had a garlic supplement with 180 milligrams of allicin, and they did that for 12 weeks. And the people that were taking this garlic supplement, they had significantly less number of colds, and also they had a shorter duration until recovery, and by a whole day. And so when we're talking about something that's a 7-day course typically of illness, a day is a long time to get rid of that last day. So over here is garlic, and like I said, this supplement, it had something called allicin in it. So alanine is actually what's found in garlic, and you have a salivary enzyme, so you have an enzyme called alanase that with water and alanine converts it into allicin. And so allicin is what I said was in this supplement. Allicin is very unstable compound, and it tends to degrade pretty rapidly. So I think that probably getting it through dietary sources may be just kind of my own conjecture, but a better way of getting this, right? Because we know that allicin is pretty unstable, and when we try to put it into something like pill form, there's probably a lot that's lost, as opposed to if we're just eating, directly garlic within the diet. And then so this is another more recent, so this is 2016, another study looking at garlic after the Cochrane review, but they did an aged garlic extract, and so they had 2.6 grams of this extract of garlic, and say they either put them in a group receiving it or put them in a group that wasn't receiving it for 90 days. After 45 days, they had a more active immune response, so healthier immune cells. And then after 90 days, if they were taking the supplement, the severity of colds and flus was decreased. They missed less days from work or school. However, in this particular study, whether or not they actually came down with a cold in the first place, it wasn't really different between the two groups. But still, if you were taking the garlic and you did get sick, you felt a lot better. So since we've talked a lot about dietary supplements, I thought it was worth mentioning how we can choose a dietary supplement. So these things are not regulated by the Food and Drug Administration, and so oftentimes, the quality between products will differ quite greatly. So you can have a product that doesn't really have as much of what it says it has in there. It can be contaminated with something. In some cases, it could even be adulterated with, a pharmaceutical medication in there. So there's lots of these third-party places that will verify that what the supplement says it has actually has. And I think the most common one that you probably see is this USP label. You guys have seen that before? Yeah. And so that's a common one to look out for, but these other guys as well. Consumer Lab also has their own third-party verification, and they have a website that you can actually log on to, consumerlab.com, and you have to get a membership that's a small fee for, but you can check to see if your supplement has been approved and verified, and if you're looking for something, they have a list of things that would be suggested, and they come out with some nice reviews too. So exercise in infection, I think, physical activity, its effect on immune function is really understated, and it's really important. So with regular moderate intensity exercise, you actually have a reduced number of sick days. When you become vaccinated, you get improved antibody response, so you have greater protection, and then possibly you might have fewer times that you're actually coming down with an upper respiratory infection. And that's thought to be by several mechanisms. So after you exercise, you have this stimulation of the immune system that happens that's good and protective. You have reduced influx of inflammatory cells into the lungs. And then exercisers have an overall lower kind of inflammatory effect than other persons. So what is moderate intensity exercise? So there's two ways that we can look at that. So you could either do it based upon your heart rate or based upon how you're feeling. So if you're going to do it based on your heart rate, there's a calculation. So if you're wearing kind of a heart rate monitor, if you take 220 and you subtract your age from that and you get a value, and then you take 50 to 70% of that number, that's kind of the heart rate goal for you to be at moderate intensity exercise. If you're going to do it based upon how you feel, so with moderate intensity exercise, your breath should be quick, but you shouldn't be out of breath. And you should have a slight sweat after about 10 minutes of doing that work. And you can carry on a conversation with someone, but you definitely would not be able to sing. And so lots of different things count as moderate intensity exercise, right? So we can do dancing, gardening, walking, cycling, swimming. So there's lots of different ways for us to get in good moderate intensity exercise. So there have been randomized controlled trials on exercise and something called mindfulness-based stress reduction. Has anyone heard of MBSR practice, mindfulness-based stress reduction? No. So MBSR, mindfulness-based stress reduction, is kind of like a meditative type training that teaches us how to be present in the present moment and without judgment. Mm-hmm. So teaches us how to separate ourselves from this constant stream of thought that we're all having and just be present and have gratitude. These trials, these ME-PARI trials, were looking at whether or not this practice of MBSR and exercise was helpful for preventing respiratory infection. And they had two different trials. The first trial was looking at respiratory infection and if it decreased the amount of times you became sick, the duration that you were sick and how severe it was. And then the second trial was just to say that the first trial we got the same outcomes, and they looked at these other measures of sleep quality, stress, and depression. And so they found in these trials, these ME-PARI trials, that MBSR, people that were trained in MBSR and practicing it, I want to say it was over the course of about 6 to 8 weeks, but they had a 33% reduction in incidence, so a 33% reduction in the amount of times that they became sick, a 43% reduction in the amount of the length that they were sick for, and a 60% reduction in how severe they felt symptoms were. For exercise, it was 29% reduction in coming down with illness, 42% reduction in the length of time, and 31% reduction in severity of symptoms. So both MBSR exercise, very helpful. The second MUPARI trial looked at mental health, sleep quality, stress, depressive symptoms, all of those things improved as well. So when we're looking at interventions, we of course want to look at the totality of their effects, right? So, definitely MBSR, exercise, helpful on many different levels of keeping us well. So some resources that I like to give to my patients to foster this mindfulness, like we said, this MBSR practice of being mindful and present in the present moment. John Kabat-Zinn, we consider him the pioneer of MBSR, but he has a really great book, Full Catastrophe Living. It's in print, you can listen to it too, but it's kind of an orientation into this practice. Also, if you have a smartphone, there is a free app called Insight Timer. This is what the icon looks like, but I really like this app because it's very user-friendly on your phone. You can filter it by time. You can do meditation activities that are as short as 1 minute, as long as an hour, and everything in between. And the other thing that's really nice is that it's free. And so at the end of the talk, if any of you guys have any additional things that have been helpful for you with respect to meditation or breathing exercises, etc., please do share, because I think we all can learn from each other. So positivity and emotional style as protective factors for cold and flu. Who would have thought, right? So there's 2 studies I'm going to show you briefly, but they took people and they had validated questionnaires, and they filled out the questionnaires, and they decided if they were very positive persons or very negative persons, or if they fell somewhere in between. And then they actually infected them with rhinovirus. They gave them a squirt of rhinovirus to make them sick with cold. And then in the second study, they gave them either rhinovirus or they gave them flu. And then they did 2 things. They asked them, how do you feel? And so you would think, well, yeah, the positive people are going to say that they feel good, and the negative people are going to say they feel bad. But they also did objective measures. So they took out their nasal secretions, and they measured them for markers of inflammation and how much virus they had present. And so in the cold, where they gave them rhinovirus, the people that had a positive outlook actually felt better, as well as had improved objective symptoms. And then the same thing held true when they did it later with cold virus and with flu virus. So it was protective against flu as well. And this is a figure that I pulled out of the first paper that was looking at positive emotional style. And we can see that, so this white bar is people that were considered to be highly positive. The black bar is people that were more negative, and then this gray bar was kind of in between. But we can see that the objective measures, so like I said, the measuring of virus and inflammation, et cetera, was a lot lower around people that had this positive emotional style. And then the same thing for subjective measures when we ask them how they're feeling. And so there's probably a lot of mechanisms by which this positive emotional style, meditation, breathing, mindfulness all kind of works. And so I just wanted to briefly share with you about the vagus nerve. And so there's 2 big parts of our nervous system that we can consider. So there's kind of this parasympathetic nervous system, which is our rest and relaxation. And then we have sympathetic nervous system, which is this fight or flight. And so the vagus nerve is part of this rest and digest parasympathetic system. And it's one of our cranial nerves, so it begins in the brain, and then it has branches, and it comes out and innervates multiple organ systems. And so don't get too caught up in the complexities of this figure, but what I was hoping to show you is that, so down here we have an immune cell, and it's releasing these chemical signals into the blood, and it's taken up by a branch of the vagus nerve, and it goes back to the brain, and then the brain sends out via the vagus nerve a signal to these different organ systems to participate in the immune response and to feed back on this inflammatory signal to kind of suppress it a little bit so it doesn't get out of uncontrolled and dysregulated. And so the best thing that we can do is try to retrain the vagus nerve, if you will, and make the vagus nerve healthy so that it's able to do its job appropriately. And what's really great is we can actually voluntarily recruit this involuntary nerve, and we do this simply just by belly breathing. So diaphragmatic breathing, and what that is if you place one hand on your belly and you take in a big deep breath in through your nose to the point where you can actually feel your belly rise and expand, and then let it fall again. It actually stimulates the vagus nerve down here, because the vagus nerve, like we said, it begins in the head. It's this thick black line here. It goes down the neck, through the chest. It goes under the diaphragm, which participates in that belly breathing. And when you take that big, deep breath in, the diaphragm moves down, and it helps to stimulate the vagus nerve. And so with more stimulation of the vagus nerve, the more often it wants to fire and be well, if you will. And so there's lots of, like I said, the vagus nerve innervates so many different systems within the body, so it has lots of really great beneficial effects. But what we're talking about today, though, is really improving immune function through consistent diaphragmatic breathing and breathwork exercises. So we have covered a ton of information, so I wanted just to take a second so we could all just do a moment for breath work. And so are any of you guys experienced meditators, or do any of you guys do breath work on a regular basis? No? Okay. All right. Okay. Well, some of you guys might find this exercise to be really hard. Some of you guys might find it easy, but don't worry. The great thing about meditation and breathwork exercises is there's absolutely no right way to do it, okay? So what I want you all to do is just kind of close your eyes. And so we will decrease some of this visual stimuli that we have. Put one hand over your belly and one hand over your heart. Okay, and and you can close your eyes, like I said, and then start to just take in some nice deep breaths in through your nose and out through your mouth. And you just do it at whatever pace seems comfortable for you. And feel the breath go in the nose and out the mouth. And you may have...
How many times?
No, so you're just going to concentrate on your breath in and out. Yeah, you just concentrate. And so, like I said, it's really normal to have thoughts that come in and out. So what you can try to do when a thought slips into the mind is just gently and without judgment redirect yourself back to just concentrating on the breathing. And so thoughts might slip in every single second while you're concentrating on the breath, and that's totally normal, totally fine. That's just a part of the process. But you just gently bring yourself back to your breath without judgment. And then while you're doing that and you're feeling the hand on your belly rise and fall, I want you just to think of something that you're really grateful for. This could be a person, this could be a place, this could be something that happened today or yesterday or 10 years ago. Just think of something for which you're just really grateful for. And kind of hold that thought in your heart and just feel the belly rise and fall. And we're just going to continue to sit here for just a moment longer. And again, if you have thoughts, that's okay. And it's completely normal. Okay. All right, and then when you're ready, you can open your eyes and just slowly come back to the room. How do y'all feel? Okay. Okay. And like I said, there's no right way to do this exercise. And really, some people really find it a hard struggle in the beginning because there's a thought that to do breath work or to meditate is to clear the mind, and that's not really the goal. The goal is really no goal at all. It's just to be present and to be in the moment and to have gratitude, and that's it. And your body will fall into place. Okay? And so there's lots of things that breath work, meditation, MBSR is helpful with. One of them is sleep. Sleep is actually helpful to protect yourself from the cold, the common cold. So there you go. So this was a study that came out looking at people and the sleep duration, so not necessarily the quality of sleep, but how long they were sleeping and whether or not they came down with colds. And so I pulled this graph from there just to show you that they had found that if you're sleeping over 7 hours a night, that tends to be most protective for protecting you from cold. And then people that were sleeping less than 5 hours each night, they tend to be most susceptible to cold viruses. So sleep is actually really important. So some things, if you're having difficulty sleeping, the first kind of thing that we recommend in primary care is sleep hygiene. And so there's lots of different ways to make sure that you have good sleep habits. I know it may seem silly, but being consistent, so trying to give yourself a bedtime each night, the same time each day that you rise, but your body really likes to have patterns, and so that will help kind of get things into check. Make sure that the bedroom is quiet and dark, that it's a comfortable temperature, something that's cool. You want to remove electronic devices from your bedroom, so you don't want to have the TV, you don't want to have a lot of screen time before you go to bed with your phones. There is something for those of you that are might not be aware, but on your phones there's oftentimes a way to set it to a sunset dimmer so that it blocks some of that blue light coming in so that you're not getting it so much in the evening times. But all of that light from the electronic devices, it suppresses our body's own hormone melatonin that helps us sleep. So you want to avoid large meals before bed, avoid caffeine, alcohol, and then getting some exercise early in the day will actually be helpful in the evening time when it comes time to sleep. Okay, so we finished the section about prevention of colds and flus. And so I don't know if you guys remember what you had kind of thought to yourself as being the lie statement. But so the incorrect statement was, although obesity is a known risk factor for heart disease and diabetes, it may be protective against cold and flu. So the right answers are that positivity and emotional style predict the odds of coming down with a cold or flu, and that shorter sleep duration actually has been shown to correlate with increased risk of coming down with a cold. And so this is a lot shorter piece of the talk, but I wanted to give you guys a couple of things that you could try if you do become sick this season or seasons to come. So again, I put up another statement, so we'll read through these together real quickly. So we're looking for the false lie statement. A, chicken noodle soup may improve cilia function and make you feel well if you have an upper respiratory infection. B, if you have a cold, you should press your physician for antibiotics. Even though viral, it will speed your recovery. Okay. And C, honey and coffee might be effective for persistent post-infectious cough. Okay, so everybody has their final answer logged in. Okay, so chicken soup. So surprisingly, chicken soup, it may not be a myth. There may be some real medicinal value to chicken soup. So traditionally, chicken soup has celeries, onions, carrots, mushrooms, sage, thyme. So all of these wonderful, beautiful things that have great antioxidant properties with some medicinal value to them. When they've studied chicken soup, they've found that it improves cilia function. So like we were talking about before, those little hairs that come up in the nasal passages and respiratory passages that help to move stuff out, that actually the cilia function is improved when you're eating chicken noodle soup. and that it increases the temperature of those respiratory passages, and it loosens up secretions. And well, so your thought may be, well, it's because it's hot water and the hot water is going to loosen it up, but they've actually looked at it in comparison to plain hot water, and there's something within the chicken soup itself that makes it superior to regular hot water. So honey for cough. There has been a lot of really good information about use of honey for cough. So honey can be used for a cough suppressant. It does a lot of different things. So it helps to kind of, it's a demulcent and helps to soothe the back of the throat so that cough reflex is more suppressed. It increases salivary production. It has some antiviral, antimicrobial properties. So honey, it's actually used in traditional medicine to expedite wound healing. So I've been surprised back when I was a medical student, I was surprised to see that a lot of the post-op patients that needed wound healing, that they actually had honey dressings, pharmaceutical honey dressings. So honey has been used, it's used all the time for wound healing. So it might actually help to that respiratory mucosa to heal better. And so this study I found very interesting because they were looking at people that had this post-infectious cough. So they feel better in all aspects, but they have this cough that just won't go away. And we see this a lot in primary care. And they were using honey inside of hot coffee, regular coffee, caffeinated coffee, 3 times daily. And they compared this to a group that was using a steroid, I think it was prednisone, versus a group that was using nothing at all. And they found that, that the honey and coffee group actually did better than the steroid group, not just the control group. So honey, like I said, it has all those beneficial properties within it, but it also has caffeine. And so caffeine can help as kind of a hypoalgesic, and it also has a little bit of kind of this bronchodilatory effect where it opens up the airways. So, and it was the most effective treatment in reducing the frequency of cough. So I think something that most people might be interested in to try. Sore throat. So a few different things that we can use for sore throat. So I think we've all heard of salt water gargles, which is actually really effective because you'll have the swelling, the fluid from the back of the throat kind of moves out of the throat, so you get decreased swelling from gargling with warm salt water. Sage gargles have also been shown to be beneficial. There was actually a study where they looked at a sage spray to the back of the throat in about 300 people compared to placebo, and the sage spray did well. I think it's a little bit hard for most people to find a sage throat spray, so a way that you could do it yourself would be just to take some fresh sage, finely chop up a teaspoon of it, put it in hot water, steep it for about 10 minutes, and using that as a gargle could be just as effective. Slippery elm lozenges, so these are widely available at drugstores, markets, but they are a demulcent, and so they have this sugary compound that actually coats the back of the throat, and can be helpful for symptoms. It's also used kind of non-traditionally for people that have reflux and things of that nature. I would mention though that if you're using slippery elm lozenges, possibly not to take them in combination with other like pharmaceutical medication, because they might have that interference with absorption of those things because of the property in which they act. So, and hibiscus tea has actually been shown to be helpful for people that have sore throat as well. And so these, I just wanted to run through them as far as we already talked about them, but to remind you that these were things that we said can be helpful if you actually come down with an illness. So zinc lozenges we talked about can help to speed your recovery of a cold. Echinacea prevention, but also for, if you do find yourself ill, vitamin C, possibly at those larger doses and maybe in combination with zinc, saline nose sprays, as we talked about earlier, will help with, or likely help with feelings of blocked nasal passages and nasal symptoms. And so I think I heard somebody say what they thought it was already. But yes, the lie statement is if you have a cold, you should press your physician for antibiotics. Even though viral, it will speed recovery. This, of course, is not true, and so we want to be prudent with our use of antibiotics and only use them when we need them and they're appropriate to prevent all those complications we talked about. And then honey and coffee, yes, it may be an effective treatment if you're having this persistent post-infectious cough. Although not studied for people that aren't having the post-infectious cough but are an active infection, it seems reasonable that it could be helpful. And then chicken noodle soup, yes, it probably has properties outside of properties that are going to help to expedite recovery. And so in summary of everything that we talked about, because I know it was a lot, but washing your hands frequently, reduce your exposure to sick persons when you're able, try to eat a balanced diet that's rich in phytonutrients and getting all those vitamin C and wonderful things that we talked about, eating from the rainbow, maintaining regular exercise and movement, reducing stress and fostering positive emotions, creating good sleep habits. And then if you did find something of interest to you as far as vitamin supplemental therapy, to talk to your physician on a more individual basis, because like I said, that these are medications and they have their own profiles that are worth taking into context in your other medical things that are happening. So that's everything. It was really great talking with you guys today, and I think we probably have a moment for questions related to today's talk. And if any of you guys wanted to talk to me about something additional aside from that, then I'm happy to stay after to talk about those things as well. Oh, thank you. Thank you. Okay. All right. No questions?
You mentioned about honey in coffee. How about
Yeah.
honey in tea?
Honey and tea, I think that seems reasonable. So although it wasn't studied, so the question was, would honey in tea be helpful as opposed to just honey in coffee? And so honey is going to have that same properties within the tea that we talked about as being helpful and making you feel better. And tea can have some of the same properties of caffeine, right? So I think that it seems like a reasonable option, although it wasn't studied specifically. But yeah, I think that sounds great to try some honey and tea. And of course, all these things, you play around with them a little bit at home. Yes,
Thank you.
yes, of course. Okay, yes.
I go outside every afternoon,
Uh-huh.
now that the cold and rainy season is coming.
Yes.
Okay, you don't sit in the rain, but is there anything I have to avoid?
As far as going outside, I would say a couple of things is we talked about kind of those hard surfaces as being harbors for viruses to live on them. So like handrails and elevator buttons and things like that. So I would be just really cautious and cognizant that after you touch those things that are kind of unavoidable, that you're either washing your hands afterwards
What
or
about sitting outside in the elements?
sitting outside in the elements. So there might be something as far as dry air, so making those mucous membranes moist that making it dry, the mucous membranes dry, so it makes us more susceptible. So I would stay really well hydrated to ensure that you're not getting dry. You could try something like the saline nose sprays to kind of keep that all moist, but I would just stay really well hydrated. You can try the saline nose sprays.
What about cold weather?
Cold weather. So cold weather is thought to be related to those viral infections because of the things that we talked about as far as you're more likely to be indoors with other sick people. The viruses tend to live better in the cold, so you got to watch out for the things that you're touching, and that our mucous membranes get dry and it makes us more susceptible to infection. So I would say that a big thing that you could do is to just stay real hydrated, maybe do a little saline nose spray and wash your hands frequently. Yeah, I hope that helps. Okay. All right. Any other questions? Yes.
What about the government guidelines, you know, the medical part of the government?
Okay.
Guidelines on vitamin D in the blood, are they too low? I've heard they're too low, you know?
So the question was, are the vitamin D guidelines too low? So it really is dependent upon other medical conditions for the patient. And I don't know that there's really a blanket statement as far as what I make to people. I kind of try to tailor it as much as I can. But I think that, it also depends upon like our lab here at UCLA, we say that like less than 20 that people for vitamin D level tends to be a deficiency state. So some practitioners just try to keep people above that, and some people try to work a little bit higher than that. But
My doctor thinks I had too much vitamin D in my blood. I don't know why. I never went outside.
Okay.
I took vitamin D just from her.
Okay,
And
okay.
supposedly it's too high, but I heard that people who are fat, like me, have a lot of fat gobbles up the vitamin D, actually.
So it has also been my experience that if people are either overweight or obese, that they have lower levels of vitamin D. So yeah.
Mine is high.
I don't know. Yeah, we have to.
Well, do
Yeah.
you have your card with you?
I do have my card, so I will. I'll give you guys my card before you leave, and I am accepting new patients at the Century City office, and I would love to have you guys over there if you'd like to come by.
Can you see an internist and you?
Yes,
An
yes.
internist at UCLA.
Yeah, no, that would be fine. You could come over to see me. Yes, okay. All right, okay, well, it was a pleasure, everyone. Thank you so much for your time. I know it was a lot of information. Yes, of course.